Welcome to PharmaconHealth. Today, we're tackling a silent threat that's spreading like wildfire across the globe. We're talking about diabetes. And the real danger isn't just the diagnosis, it's the quiet, hidden damage it causes for years before many people even know they have it. In this video, we're going to give you a full overview, breaking down what diabetes is, its different types, the early warning signs, how it's diagnosed, and most importantly, how to manage and even prevent it. We're going to slow things down, remove the confusion, and explain diabetes simply, whether you're a patient, a caregiver, a student, or just curious. So, let's start with the most fundamental question. What exactly is diabetes? First, let's talk about energy. When you eat, your body breaks down food into a simple sugar called glucose, which is your body's main fuel. But for your cells to use this fuel, they need a key. That key is a hormone called insulin. Under normal conditions, your pancreas releases insulin, which travels through your bloodstream, unlocks your cells, and lets glucose in for energy. In diabetes, this process breaks down. Either your body stops making insulin altogether, or your cells stop responding to it, a condition known as insulin resistance. In both cases, glucose can't get into your cells. It gets stuck in your bloodstream, causing high blood sugar. This is where the silent damage begins, slowly harming your blood vessels and nerves, often without any obvious symptoms for a long time. Now let's explore the different ways this can happen by looking at the types of diabetes. The first is type 1 diabetes. This is an autoimmune disease where the body's own immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. The onset is usually sudden and often happens in children and young adults. People with type 1 diabetes require lifelong insulin injections to survive. Next is type 2 diabetes, which is far more common. It starts with insulin resistance. Your cells don't respond well to insulin. Your pancreas tries to compensate by pumping out more and more, but eventually, it gets overworked and can't keep up. This progression is slow and silent, taking years to develop. The biggest risk factors include being overweight, physical inactivity, aging, family history, poor sleep, chronic stress, and a diet high in processed foods. Then there's gestational diabetes, which occurs during pregnancy. While it usually resolves after childbirth, it does increase the risk for both the mother and child to develop type 2 diabetes later in life. Finally, we have secondary diabetes, which is caused by other factors, like certain medications such as steroids or diseases that damage the pancreas. So why is diabetes increasing so rapidly worldwide? A big part of the answer lies in our modern lifestyles. Many of us have jobs and hobbies built around sitting. When our muscles are inactive, they don't handle glucose very well. Our diets have also changed dramatically. We eat more high-calorie, highly processed foods, larger portions, and consume a ton of sugary drinks. Add to that the effects of poor sleep and chronic stress. Lack of quality sleep can reduce your body's sensitivity to insulin, while chronic stress keeps your blood sugar levels elevated. And let's not forget technology. For many, screen time has replaced physical activity. All these factors create the perfect storm for developing type 2 diabetes. Now, what are the early warning signs you should watch for? Often, the first clues are increased thirst and frequent urination. As sugar builds up in your blood, your kidneys work overtime to flush it out, pulling water with it. You might also feel constantly hungry. Even though you're eating, your cells are starving for glucose they can't access. With type 1, you might see unexplained weight loss as your body starts breaking down muscle and fat for energy. Other signs include blurred vision, caused by fluid shifts in the lenses of your eyes, slow healing wounds, and frequent infections. Some people experience tingling or numbness in their hands and feet, an early sign of nerve damage. A key marker of insulin resistance is the appearance of dark, velvety patches of skin, usually in the armpits or neck. And there are emergency red flags to never ignore, like breath that smells fruity, vomiting, rapid breathing, or confusion. If you notice any of these signs, it's crucial to see a doctor. So, how is diabetes diagnosed? There are several key tests. The fasting blood glucose test measures your blood sugar after an overnight fast. A random blood glucose test can be done at any time, and a high level along with symptoms can indicate diabetes. The most common test is the HbA1c, which gives a picture of your average blood sugar levels over the past 2 to 3 months. There's also the oral glucose tolerance test, or OGTT, often used to diagnose gestational diabetes, which measures your blood sugar before and after you drink a sugary liquid. People with risk factors, like a family history or being overweight, should be tested more frequently. Once sugar is high in the blood, how does it actually damage the body? Think of diabetes as a blood vessel disease. High sugar levels damage the tiny blood vessels, which is called microvascular damage. This leads to retinopathy, which can cause blindness, nephropathy, leading to kidney failure, and neuropathy, or nerve damage, especially in the feet. It also harms the large blood vessels, which is macrovascular damage. This dramatically increases the risk for heart attacks, strokes, and peripheral arterial disease, where blood flow to the limbs is reduced. This brings us to diabetic emergencies, which can be life-threatening. Diabetic ketoacidosis, or DKA, is most common in type 1. Without insulin, the body burns fat for fuel, producing toxic acids called ketones. Symptoms include nausea, vomiting, stomach pain, and fruity-smelling breath. It requires urgent hospital treatment. Another emergency, more common in type 2, is the hypersmolar hyperglycemic state, or HHS. It involves extremely high blood sugar levels leading to severe dehydration and confusion. Early recognition of these emergencies is critical. The good news is, diabetes is manageable. Treatment often starts with oral medications that help your body use insulin more effectively or produce more of it. For many, especially with type 1, insulin injections or an insulin pump are necessary. Monitoring your blood sugar is fundamental. This can be done with traditional glucose meters or with continuous glucose monitors, also known as CGMs, which provide real-time data. Diet is a cornerstone of management. This means balanced meals, controlling portions, and avoiding sugary foods that cause blood sugar spikes. Physical activity is just as important. Aim for at least 150 minutes of moderate exercise a week. It makes your cells more sensitive to insulin. Even a small amount of weight loss, just 5 to 10% of your body weight, can have a huge impact. And don't forget other lifestyle factors. Getting enough sleep, managing stress, and avoiding smoking and excessive alcohol are all key. Finally, education and support from healthcare teams and peer groups are invaluable. Living safely with diabetes involves building consistent routines. Daily foot care is a must. Because of nerve damage, you might not feel a small cut, which can become a serious infection. Check your feet every day for any issues. Sticking to your meal and medication schedule is vital to prevent dangerous highs and lows in blood sugar. Stay hydrated, manage stress, and be prepared for emergencies. Know the signs of low blood sugar or hypoglycemia, like shakiness, sweating, and confusion, and always have a quick source of sugar ready. Consistency is your best defense. The best news of all? Type 2 diabetes is largely preventable. It doesn't require extreme measures, just simple, daily habits. Regular walking, for at least 30 minutes a day, works wonders. One of the single best things you can do is cut out sugary drinks. Focus on a healthy diet pattern rich in whole foods. Prioritize good quality sleep. Get regular medical checkups to catch any issues early. And work toward maintaining a healthy weight. Losing just 5 to 7% of your body weight can cut your risk of developing diabetes by more than half. Prevention is powerful, and it's within your reach. So, let's summarize. Diabetes is a condition where high blood sugar silently damages your body. But early detection, understanding the risks, and knowing the warning signs can make all the difference. While it's a serious disease, it is absolutely controllable. Knowledge plus your daily choices are your best protection. Whether you're managing diabetes or working to prevent it, you have the power to take control of your health. If you found this video helpful, please give it a like. Share it with someone who needs to hear this, and subscribe to PharmaconHealth for more clear, simple health education. Thank you for watching, and here's to taking proactive steps for a healthier future.